Good evening, everyone. Welcome back to another live session here at Auricle. So currently we are doing a 90-day university Proff pre-final mastery. And the topic of discussion today is diseases of lens. Okay, so we'll discuss about lens disorders today. And it will include long questions like cataract, and we'll discuss the classification of cataract, types, stages of senile cataract, and we'll also discuss the clinical features and management with recent developments of the cataract. We'll discuss about congenital cataract. We'll also discuss about the different types of cataract surgeries and the surgical procedure of MSICS, that is manual small incision cataract surgery. In the short essays, it includes zonular cataract and complicated cataract and hyphema. And in the short answers, we'll also discuss about the crystalline lens and its parts and after cataract, which is also known as posterior capsular opacity. So these are the questions that has been repeatedly asked in your previous year questions and are very important topics that is to be covered under this heading of lens disorders. And today we'll discuss each of these questions as a separate heading. And hopefully at the end, you will remember every point of these answers. Okay. So before starting our main live session, I would like to give you a brief introduction of Auricle. So here at Auricle, we have recorded classes, we have live classes, we have practical sessions, exam modules, and hard copy book set. The recorded classes offers you the freedom to choose from multiple educators for each subject, and it is recorded. It is pre-recorded so that you can watch these videos anytime at your convenience, and it also brings 10 years of experience to the table, and it includes every important topics, including your MBBS Prof exams and your PG exams. And these recorded classes also provide you with the answer writing skills so that you know what to write in your exams when you get a question and how to frame your answers, right? So these recorded classes provides you flexible learning with the expert tutors, and it is also convenient for you to revise at the last moment of time. We also have live classes like this one, where you can interact with your teachers and even participate in the live doubt clearance. And you can also participate in the MCQ polls. And these live classes includes in-depth coverage of it provides you in-depth coverage of all the important topics in the previous 10-year topics that has to be included. And it is also taken up by the experienced educators. Okay. Now, we have express exam modules. This is basically for your revision. Okay, this is basically for a revision, and you can revise the entire syllabus in under 20 hours, and you can also go through this entire exam modules just before your exam so that you know how to write your answers. And these are taken up by the expert educators. Okay. Now we also have one-to-one live doubt clearing session, which is which is in a very student-centric approach, and a personalized attention is given to the students, and it creates a safe learning environment. We also have hard copy note set, which is made in a very crisp and concise manner, so that you know what to write in your so that it becomes easy for you to remember all the topics, and it also gives you the in-depth understanding of the topics, and it also has previous 10 years questions, right? Previous past 10 years questions and the most anticipated questions that could come in your exams, and it also includes colorful diagrams, and the whole notes is made in such a way so that it becomes a fun learning session for you. Okay, and next we have question banks also, which is must to practice, because before any exam, it is important to practice the questions, right? And it covers the MCQs for all your Prof exams, for your PG exam, and also for your FMG exams. Okay, last but not the least, we also have practical sessions. These sessions are very useful for your practical exams, and you also know that these practical sessions carry equal weightage. Your practical exams carry equal weightage as that of your theory exams. So practical sessions should not be missed. And these Auricle practical classes, it provides you hands-on experience, and it guides you through about all the practical aspects. And it also tells you how to answer your Viva questions. and it gives you the confidence and the skill which is needed for your practical exams. Okay. So we have 4 kind of subscription plans here at Auricle. It is foundation plan, advanced learning plan, complete learning plan, and ultimate MBBS plans. So it is according to the duration of the validity. So it is 3 months, 6 months, 12 months, and 4 years. So if you want for every subject, okay, if you want it for every subject, then you can opt for the ultimate MBBS plan, which is 4 years, and you will get all the benefits. That is pre-recorded classes, live classes, your revision sessions, your practical sessions, your Q banks, your notes, okay, doubt clearing session, everything you will get in this ultimate MBBS plan, and your complete MBBS curriculum will be provided to you at your hand. Okay, so now let us start a lecture, that is diseases of lens. Okay, so first thing that we are going to discuss is a senile cataract, and first we are going to discuss about the definition of a cataract. So a cataract is an opacification or clouding. Okay, a cataract is an opacification. So this term is very important, opacification or clouding of the crystalline lens of the eyes. Okay, leading to reduced vision. So again, we'll draw a simple diagram. This is our cornea. This is our eyeball, right? And where is lens? Lens is placed over here. Okay, and what holds the lens? The ciliary muscle. These are the ciliary muscles. I will write it back. These are the ciliary muscle which holds the lens. Okay, so this blue color is the lens. So this lens is placed like this, and it is a crystalline lens. Okay, so if this lens has been opacified, okay, or the clouding has happened in the lens, that means the crystalline lens has reduced it has less power of vision. Okay, that means that you will not be able to see the things clearly, and it leads to the reduced vision. So that is the definition of a cataract. So cataract is an opacification of clouding of the crystalline lens. You can see in this diagram over here, the lens has become very cloudy. Okay, it has become very cloudy. Through the pupil, you can see the lens. Okay, this is the pupil, and behind the pupil is the lens, and you can see the cloudy material behind the pupil. Okay, so this is the cloudy material or clouding of the crystalline lens, leading to the reduced vision. Okay, now classification of cataract. It is based on the age, and it is based on location. Okay, based on age, it is senile cataract, it is congenital, developmental, traumatic, and secondary cataract. Okay, so these are the types of cataract on the basis of the age. So we have senile cataract, we have congenital cataract, we have developmental cataract. Okay, congenital and developmental, it is one and the same thing. Okay, we have traumatic cataract, and we have secondary cataract. Okay, this is based on the age, and based on the location, we have nuclear cataract, cortical, and posterior subcapsular. So these are the 3 types of cataract on the basis of the location of the lens. Okay, if the lens is if the cataract is placed on the nucleus of the lens, okay, that is known as nuclear cataract. If it is placed, if the cloudiness is present only on the cortex of the lens, then it is known as cortical cataract. If it is placed on the posterior subcapsular region of the lens, okay, we'll see each of these types when we study about the parts of the lens. Okay, when we study about the parts of the lens, then it will become clear what are the types of cataract and how do we classify this cataract. Now, second thing, we are going to discuss in detail about the senile cataract because it is important, and the cataract mainly occurs in a person, in elderly person, okay, above 50 or 60 years of age. So cataract is not very common in young persons. Okay, so the types of senile cataract includes nuclear cataract, cortical, and posterior subcapsular. These are the types of senile cataract. These are the types of senile cataract. Okay, types of senile cataract. So you can see in the diagram over here, you can compare the normal eye with the cataract eye. You can see in the cataract eye, there's cloudiness present, and in the normal eye, there's no cloudiness present. Okay, so that is the reason of the reduced vision. The cloudiness of the lens is the reason for the reduced vision in the cataract eye. Now the stages of senile cataract. So the stages of senile cataract includes 4 stages. First is the incipient stage, right? Second is the immature, or you can also say intumescent stage. Third is the mature stage, and fourth is the hypermature stage. So these are the 4 stages of senile cataract. So incipient stage, that means it is a very early stage. So this in incipient stage, very minimal and very early changes occurs in the lens, okay, which does not seriously hinder your visual acuity or visual function. Okay, so there is very minimal visual disturbance, and these represent early changes, and very minimal visual disturbance is present in incipient stage. Second, we have immature stage. So in the immature stage, lens opacity increases and some swelling is also present. Okay, the lens opacity increases and the lens becomes swollen. Okay, the lens becomes swollen. And in the mature stage, complete opacification of the lens is seen, whereas in the hypermature stage, shrinkage of the lens with leakage of lens proteins. So the lens will shrink. Lens will shrink means in the immature stage, there was swelling of the lens like this, okay? And in the hypermature stage, there will be shrinking of lens like this. The lens will become very shrink, okay? The lens will become very shrink, and there will be leakage of the proteins because the lens is going to absorb on itself. Okay, if the lens is going to absorb on itself, the lens can become completely absorbed and the lens can become, lens can disappear. Okay, lens can disappear and lens can absorb on itself. And on absorbing, the lens proteins are there are some proteins present on the lens material. Okay, in the crystalline lens, there are some proteins. These proteins can leak into the, where it can leak? It can leak into the outer side, or you can say it can leak into the vitreous humor. Okay, in the vitreous or in the aqueous humor, it can leak. Okay, so this is about the hypermature state. So we have four kind of stages and four kind of changes that happens in the stages of senile cataract. So we have incipient stage, we have immature stage, we have mature stage, and we have hypermature stage. So incipient stage includes early changes and minimal visual disturbance because the opacification is very mild. In the second immature stage, there is swelling of the lens. Okay, there's some swelling of the lens and the opacity of the lens increases. And this is also as intumescent stage. Intumescent means in the middle, okay, intumescent stage. Then we have mature stage. In the mature stage, the lens has become completely opacified. Okay, the lens has become completely opacified. That is the mature stage. That means your visual acuity is zero. You cannot see anything. Okay, you cannot see anything. That is a mature stage. In hypermature stage, the lens, in the hypermature stage also, you cannot see anything. But in addition to that, there is shrinkage of the lens with leakage of lens proteins. Okay, so this is about the types and the stages of senile cataract, and the four stages is very important. Okay, and you should remember about each of the stage. Now we'll discuss about the clinical features of senile cataract. Okay, so what are the clinical features that we observe in a patient of a senile cataract? So symptoms and signs. Okay, so what are the symptoms and what are the signs that we see in the patient of senile cataract? So there is a gradual and painless loss of vision. So cataract is a disease which is a very gradual disease. Okay, it is a gradual disease. It is not like that one day your eyes is very normal and the second day you develop cataract and your vision is lost. It will not be like that. Okay, acute cataract is very, very, very rare, and it can only happen when you have ocular trauma. Okay, for example, you have been in an accident, or there has been a fighting, eyes are involved. So in that case only, your eyes can develop acute cataract. Otherwise, acute cataract is very, very rare. So it is a very gradual disease and happens in a due course of time. Okay, it is a very gradual disease and happens in a due course of time. So there is a gradual, painless loss of vision. You will not feel any pain. Okay, and that is why most of the rural people, they never get their eyes checked because it is not causing any pain. They only think that their vision is getting lost because of their uh, progressively older age. Okay, but that is not the reason. In every older individual, cataract is not there, and most of the older and some of the older people also have good vision like the younger people. But it is a common thinking among the rural people that there is no disease, and they don't recognize cataract as a very disturbing disease. Okay, unless they have pain in the eye, they don't come to the doctor and get checked. Okay, so that is why cataract is very prevalent in the rural elderly population. Okay, now the second symptom of cataract is there is glare. Okay, especially at night. Glare means you see some spots. Okay, some spots, and the vision becomes very blurred, and it happens mostly at night. So this is glare. Okay, and there's double vision in one eye. Okay, in the eye that in the eye in which you are having the cataract, there is double vision. Okay, This is also referred to as diplopia. You must be knowing by this by now this. Okay, so this is diplopia. So you will be seeing double vision because the light rays that is focusing on your retina is not one, but two light rays are focusing to more than one light rays is focusing on the retina. And difficulty in reading and identifying colors because you know what, if the lens is diseased, if the lens is impaired, then everything, your vision and your ability to see colors and your ability to accommodate, everything will be diminished or everything will be disturbed. Okay, so the cataract is a disease of the lens, we know. And if the lens is disturbed or if the lens is impaired, okay, then everything will be impaired. So there is loss of vision, there is glare, there's diplopia, and there's difficulty in reading and identifying colors. Okay, so these are the common symptoms, okay, that you can observe in a patient of cataract. Okay, you can also include photophobia. Okay, photophobia is also present in some of the patients of cataract. Okay, so this is the symptoms of cataract. Now the signs of cataract, how do you know whether it is cataract or not by seeing the signs, clinical signs? So pacification of the lens on slit lamp examination. So slit lamp examination is one of the most widely used investigation technique or widely used diagnostic technique to determine the cataract and glaucoma patients. So slit lamp examination is done, and on the slit lamp examination, you can see the opacification of the lens if there is present. And you can also see there's reduced visual acuity, which can indicate towards the senile cataract. Okay, so these are the two signs, that is reduced visual acuity and opacification of the lens on slit lamp examination. You should remember the slit lamp examination is very important. Okay, so this was about the symptoms and the signs of the senile cataract. Now, how do you manage senile cataract? So mainly management of anything we can divide into two techniques, like surgical and non-surgical techniques. Okay, so non-surgical techniques, it is very limited options are present, like mainly vision aids like glasses or magnifiers. Okay, for example, if the person is only having vision problem due to cataract, so he will not prefer a surgery. Okay, for the decreased vision, he or she will not prefer in surgery. Instead, they will prefer to wear the glasses. Okay, they would prefer to wear the glasses because it is cheaper and more safe and more economical for them. Okay, so they will prefer glasses or magnifiers. Okay, and if the vision, if the vision is completely lost, okay, then they have no other option than surgery. And in the surgery, it includes phacoemulsification. We'll discuss phacoemulsification in detail. Okay, phacoemulsification, and the second is extracapsular cataract extraction. In short form, it is known as ECCE, extracapsular cataract extraction. Okay, this is not commonly used. This is very, very commonly used. Okay, so if you hear any patient, any person undergoing cataract surgery, okay, then it is understood that the person is undergoing this phacoemulsification surgery. Okay, because this is the most commonly used surgery, and it has many merits also compared to the other cataract surgeries. Okay, now what are the recent advances in the cataract surgery? So we have opted for this FLACS, which is also a femtosecond laser resisted cataract surgery. Okay, this is a new type of surgery, and it is more good than phacoemulsification. It is more good than phacoemulsification, but it's very costly and not available everywhere. Okay, it is not available everywhere. More good than phacoemulsification. Okay, and you can also use trifocal intraocular lens for improved vision quality. So you can use trifocal intraocular lens also. So these are the two new techniques that have been developed. Okay, but due to the resources, due to constrained resources, and also due to the economical issues, these are not preferred. And the most widely used cataract surgeries nowadays, okay, currently the most commonly used surgery is phacoemulsification. So you should know about the phacoemulsification, and you should just know the names of other surgery and other advancements that has happened in the cataract surgery. Now, phacoemulsification. So what is the phacoemulsification? So it is an, so how do you proceed with it? So ultrasound is used to break up the lens and fragments are then aspirated. Okay, so an ultrasound wave is passed to break up the lens. Okay, it is used to break the lens, or uh, it is used to tear up the lens, and the fragments that are obtained after breaking the lens, it is then aspirated. Okay, now what are the advantages? Okay, you can see in this diagram, this is a probe. Okay, this is a probe. Okay, it is used, this is a corneal flap. I'm highlighting it with the red highlighter. Okay, this is a flap, corneal flap, and the corneal flap is raised. The corneal flap from here, it is raised till here. So this is the corneal flap, and this corneal flap is raised to access to the pupil. So this is the pupil, and behind the pupil we have lens, and we have access to the lens. So lens is broken. Okay, and lens is then aspirated. Okay, this is aspiration of the lens. Okay, it is getting aspirated in the probe itself. Okay, it is aspirated in the probe. And then what happens? This is the new intraocular lens. This is the new intraocular lens that has been implanted. Intraocular lens that has been implanted instead of the lens. So this was the old lens. Old lens is completely broken up and the fragments are created, and the fragments are then aspirated by this probe. Okay, the fragments are aspirated by this probe, and then again new lens is implanted. So what are the advantages of phacoemulsification? It is a small incision size. Okay, small incision is made. It just in the small incision is made in the cornea just to remove the corneal flap, and there's quick recovery after the surgery. There is minimal induced astigmatism. So astigmatism can be a complication of this surgery, but it is very minimal. Okay, so we can take the risk of this minimal astigmatism. And third, it can be performed as a daycare procedure. What do you mean by daycare procedure? Daycare procedure means you are telling the patient to come in the morning. Okay, you're telling the patient to come in the morning. He or she gets admitted in the hospital, and then you perform the surgery in the daytime. Okay, and the total time this surgery takes, it is about 1.5 hours. Okay, and in the evening, the patient gets discharged. So that is a daycare procedure. In the daycare procedure, that means you're not just admitting the patient for 2 to 3 days. It is just like the morning the patient comes, he or she has surgery in the daytime, and then in the evening the patient gets discharged. Okay, so that is known as daycare procedure. So this procedure is performed as a daycare procedure. Okay, now that was about the senile cataract. Now second type of cataract that we are going to discuss is congenital cataract. Okay, so the congenital cataract, the name itself tells us that it is present since birth, and the developmental cataract, it arises in the childhood. So these both present, the etiology of these both is more or less the same. Okay, so the congenital cataract and the developmental cataract, we can study it together. Okay, so congenital cataract means present since birth, and developmental cataract means it is acquired during the process of development of the child. Okay, what are the etiology? It can be due to genetic mutations. First, very important etiology, that it can acquire as a genetic mutation. Second, maternal infections like rubella. Okay, rubella is a very serious maternal infection. If a female is pregnant and she has acquired rubella infection, then she is advised, she has to be advised that the termination of pregnancy to be done, because rubella can cause so many disorders in the children, which is being born. Okay, so genetic mutations, maternal infections, and metabolic disorders of the children. Okay, so these are the three main etiology, which can give rise to this congenital cataract: genetic mutations, maternal infections like rubella, and third is the metabolic disorders. Now, what are the types of congenital cataract? So we have these many types. Okay, I will just tell you the important ones. Like lamellar cataract is very important. We'll discuss also lamellar cataract, then nuclear cataract, zonular cataract, posterior polar, anterior polar, sutural, blue dot cataract. Okay, so I will just list it down over here. Lamellar cataract, lamellar and zonular, these are same. Okay, more or less these are same. Nuclear, but for the sake of classification, we are studying it as different types of cataract. Posterior polar and anterior polar combined, they are known as polar cataract. These are not very common, the polar cataracts. Okay, sutural cataract is also not very common. Blue dot cataract. So these are the types of cataracts. Okay, lamellar, nuclear, zonular, posterior polar, anterior polar, sutural, and blue dot. These are 7 types of congenital cataract. Okay, the most important one is lamellar, and we are going to discuss about this. Okay, lamellar. Okay, now what are the clinical features and management of the uh, developmental cataract or congenital cataract? So there's vision impairment. Obviously, if the cataract is present, there can be vision impairment. It varies with the opacity, location, and extent. Okay. Now this visual disturbance, it varies with the opacity, location, where is the opacity present, and to what extent is the opacification present in the lens. Okay. Now white pupillary reflex in severe cases. In the severe cases, there is white pupillary reflex in the children. So this is a different phenomenon that we will discuss later on when we study about the pupillary reflex. So white pupillary reflex is present in severe cases, and vision impairment, it varies with the opacity, location, and the extent of the opacity present in the lens. Now, how do you manage this condition? So there is early surgical intervention in significant cases, because this is the child, and you cannot make a child to wear glasses. If it is a 6-month-old baby or 10-month-old baby or 1 to 2-year-old children, okay, you cannot make them to wear glasses, and glasses are not made for them. Okay, so early surgical intervention is required in most of the cases, unlike the senile cataract. Okay, visual rehabilitation with IOL or contact lenses. So you can prescribe contact lenses to them, but it is also it has also some side effects. So visual rehabilitation with OL is usually recommended. Okay, like you surgically implant IOL and then visually rehabilitate the child. Okay, what are the complications of this childhood cataract? A child can develop amblyopia, strabismus, or secondary glaucoma. Okay, strabismus means squint. So squint, amblyopia, and secondary glaucoma are the complications that can arise due to this congenital cataract. Okay. Now, next, how do you classify the cataract surgeries? Classification of cataract surgeries, it includes intracapsular cataract extraction, extracapsular cataract extraction, phacoemulsification, which is most widely used and commonly performed surgery, and the last one is manual small incision cataract surgery. Okay. So these are the 4 types of cataract surgery. So this first is intracapsular cataract extraction. Okay, these two are not used nowadays. This is most widely used, and this is also used in some places. So we have discussed about the phacoemulsification in short. Okay, if you get a question about phacoemulsification, I hope you can write the answers about its advantages and about its procedure. Okay. Now, we will also discuss about this manual small incision cataract surgery. Okay, this was performed earlier. Before the development or before the advent of phacoemulsification, the most widely used surgery was small incision cataract surgery. Yes, it is also preferred and done by old ophthalmologists. Okay, it is also done by old ophthalmologists. Okay. So, 4 types of cataract surgery: intracapsular, extracapsular, phacoemulsification, and manual small incision cataract surgeries. Okay. Now we'll discuss about the manual small incision cataract surgery in detail. So the steps includes first you have to give the incision, right? First you have to give the incision, and this is a very small incision, okay, which is a self-sealing scleral incision. In the phacoemulsification, we were giving the corneal incision. Okay, in phacoemulsification, we were giving corneal incision. In phacoemulsification, it was corneal. And in manual small incision cataract surgery, it is scleral incision. So just know the difference between these 2 surgeries. So a scleral incision is given and capsulotomy is performed. Capsulotomy is creating an opening in the anterior capsule. Which capsule? What capsule? So this is the lens. Okay, this is the lens. This is the lens. This is a crystalline lens. This is the anterior part. Okay, and this is the posterior part. Okay, and if I have to draw the cornea, so this is the cornea, and this is the eyeball. This is a very bad diagram, but just you understand what I'm trying to say. Okay, so this is the lens. Okay, so this is the lens, and this is the anterior capsule. This is the posterior capsule. This is the anterior capsule. This is the posterior capsule. So we are creating an opening in the anterior capsule. First of all, what did we do? We entered through the sclera. This is the sclera. We made an incision on the sclera, and we entered through the sclera to here. So now we entered through the sclera till here, and we are creating an opening over here in the anterior capsule. Okay. Now what we are doing? We are nucleus extraction is lens nucleus expressed manually. After entering over here, okay, there is nucleus of this lens placed over here. Okay, this is the nucleus of the lens, and what we are doing, we are manually expressing the nucleus. That means we are manually taking out the nucleus. Okay, we are manually taking out the nucleus, and cortex aspiration IOL insertion is done. Cortex aspiration means after entering from the anterior capsule, this is the cortex present over here, and we are aspirating all the cortex. Okay, what will happen? The lens will absorb, or the lens will degrade on itself, and new IOL is implanted. So I'm just going to tell you about this again. Okay, now there was nucleus expression, lens nucleus expressed manually, and there was cortex aspiration, IOL insertion. Okay, so what you're doing, first you are making an incision on the sclera. You made an incision on the sclera. Okay, so you made an incision on the sclera. After making an incision on the sclera, you enter to the anterior capsule. Anterior capsule, you are expressing the nucleus, means you are degrading the nucleus. After you have degraded the nucleus, you are aspirating the cortex. And if you have aspirating the cortex, and along with that, the degraded nucleus also comes with it, and all the material is you are aspirating. So whole of the lens you are aspirating. Okay, so whole of the lens you are taking out. And after taking out the whole of the thing, then you are again implanting a new lens. That is IOL, that is intraocular lens. Intraocular lens, which is a new lens of the desired power. Okay, so this was about the manual small incision cataract surgery. It is named manual small incision because small incision is made in the sclera, and it is done manually. Okay, it is done manually because you are creating an opening, you are creating a incision all by yourself. Whereas in phacoemulsification, the probe does all the thing. Okay, you don't have to manually do all the thing. You just have to turn on the probe, and you just have to put the probe in the cornea, and automatically a corneal flap is made. Okay, so that is phacoemulsification, and phacoemulsification is more common nowadays because it is not manual, and the small incision cataract surgery was manual. Okay. Okay, so we have discussed about the manual small incision cataract surgery. Now we'll discuss about the zonular cataract. Okay, so it is a type of childhood cataract, or you can say congenital cataract. So it involves the zonular fibers. Okay, now I think that you must know. I think that you know the meaning of zonular fibers. So this is the cornea. This is the lens. Sorry, this is the eyeball, or you can say whatever sclera retina. So this is the cornea, and this is a complete eyeball. Okay, now what is zonular fibers? So this is our lens. Okay, and lens is held by the zonular fibers. These zonular fibers is attached to the ciliary muscles over here. Okay, these zonular fibers are attached to ciliary muscles. Okay, the ciliary muscle hold the lens with the help of zonular fibers. Okay, so this cataract involves the zonular fibers leading to a specific pattern of lens opacity. Now you can see here in the diagram this opacity, this specific opacity. So the opacity is present in a particular zone. Okay, the opacity is not present throughout. Okay, the opacity is not present throughout. Instead, it is present only in specific zones. So this is known as zonular cataract. And you can also visualize from this diagram. This is the zone. This is the zonular fibers, and it involves only this. So surrounding, so in the periphery only you can imagine the opacity. So in the periphery only there is opacity in the zonular fibers. So this is about the zonular cataract. Now, what are the characteristics of the zonular cataract? So it presents as concentric zones of opacity around the nucleus. It presents as the concentric zones of opacity around the nucleus, and it is often associated with the conditions like Marfan syndrome. This is a very important point. Okay, zonular cataract is associated with the Marfan syndrome, and it presents as a concentric zone of opacity. You can see over here, it presents as a concentric zone of opacity around the nucleus. Now, how do you manage this condition? Observation or surgical intervention based on the visual impairment. So, if the visual impairment is minimal, then you can observe for some time. If it gets progressively worsened, then you have to surgically intervene and you have to perform the cataract surgery like phacoemulsification or the manual small incision cataract surgery. Okay, so you can perform that, or you can observe also if the vision is not severely impaired. Okay, so that was about the zonular cataract. Now, complicated cataract is another type of cataract. Okay, so what is complicated cataract? So it is a cataract secondary to intraocular condition like uveitis or glaucoma. Okay, but this cataract is not developing due to its own, rather than it is developing due to conditions like uveitis or glaucoma. So uveitis means inflammation of the uveal tract. Glaucoma means raised IOP. Glaucoma means raised IOP. Okay, and uveitis means inflammation of the uveal tract. We have discussed about this in our previous lectures. Okay. So the cataract developing secondary to these conditions like uveitis and glaucoma. Now, what are the causes of this? So the causes also will be uveitis, glaucoma, retinal detachment, or intraocular tumors. Okay, so these are the 4 causes that can cause complicated cataract. Okay. Now, what are the clinical features of this complicated cataract? You get a snowflake cataract. Okay, snowflake cataract, and there will be posterior subcapsular opacities. So the opacity in this complicated cataract will appear like a snowflake like this. Okay, I'm drawing it in red color, but the lens will appear like this, and this whole thing will be in the white color like snow. Okay, so that will be snowflake cataract, and there can also be posterior subcapsular opacities, reduced visual acuity, and glare can be present. So these are the clinical features of complicated cataract. Okay, you will see snowflake cataract. You will see posterior subcapsular opacities. Posterior subcapsular opacities means, for example, this is the lens. This is the lens. Okay, and this is the lens, and the posterior side. So this is the posterior capsule. This is the anterior capsule. Okay, the capsule covering the anterior part of the lens is the anterior capsule, and the capsule covering the posterior part of the lens is posterior capsule. So just beneath the posterior capsule, you are having the opacity that is known as posterior subcapsular opacity. Okay, that is known as posterior subcapsular opacity. Now, our next topic of discussion is hyphema. So I think we have discussed about the hyphema earlier also, but we'll just discuss it in short now. So it is the accumulation of blood in the anterior chamber. You can see in the diagram. See, this is the whole blood. This is the blood. It has been accumulated in the anterior chamber of the eye, often due to trauma. So if there is trauma, the vessels would bleed, and the blood will be collected in the anterior chamber of the eye. Okay, and similarly, one more thing that was happening in the pus. Okay, so if the pus is getting collected in the anterior chamber, instead of blood, if it was pus, then it will be known as hypopion. Okay, if there's pus in anterior chamber, that is known as hypopion. If there's blood in anterior chamber, that is known as hyphema. Okay, just know the difference between these 2 words. Okay, now what are the causes? Okay, and it is due to the trauma. It is due to the trauma. Now, what are the causes? There can be blunt trauma, post-surgical complications, and there can be bleeding disorders. Just remember one of the bleeding disorders. I'll give 1 minute to remember. If you remember it, well and good. But if you don't remember it, then this is the most common bleeding disorder. Okay, this is the most common bleeding disorder. This is hemophilia. And in the most severe cases of hemophilia, you observe in the patient of hemophilia A that hyphema is present. Okay. So that there can be blood. So the causes include blunt trauma, post-surgical complications, and bleeding disorders. And the complications includes increased intraocular pressure and corneal blood staining. So the cornea can be blood stained, and there can be increased intraocular pressure due to the accumulation of blood repeatedly. How do you manage this condition? head elevation. If you are elevating your head, that means the blood will flow up and it can get absorbed. Bed rest and topical steroids. These are the conservative management. Surgically, if you want to manage, anterior chamber wash out in severe cases. So in severe cases, you have to wash the anterior chamber and you have to wash the blood present or collected in the anterior chamber. So this was about the surgical management of the eye field. Now, I told you that we are going to discuss about the parts of the lens. Okay, so what are the parts of the lens? Just see this diagram. This is the anterior part and this is the posterior part. Okay, this is the posterior part and this is the anterior part. Now, you can see the anterior part is not very curved, but the posterior part is very curved. Okay, so the anterior part is not curved and the posterior part is very curved. That means the posterior part is more convex. So this is more convex. Posterior part is more convex. Okay. Now we have three parts of lens. First is capsule, second is cortex, and third is nucleus. Capsule means the outermost covering. Okay. You can see this diagram here. This is the anterior capsule. Okay. This is the anterior capsule. And this is the posterior capsule. Posterior capsule is very thin. Anterior capsule is comparatively thick. Okay. Second is the cortex, which is the outer layer of lens fibers. So the cortex is the outer layer of lens fibers. Cortex is the outer layer of lens fibers. So this concentric lines that you are seeing, this is all about the fibers. Okay. This is all fibers. Nucleus is the central part of the lens. Nucleus is the central part of the lens. This is the nucleus. And rest, everything is the cortex. This is all the cortex. Okay. This is all the cortex. So this is about the three parts of the lens. Okay, and diagram is very necessary of the lens. You should know about the diagram of the lens. So capsule, draw capsule, anterior capsule like this, and posterior capsule like this. Okay, and there is cortex present. First of all, draw the nucleus. This is the nucleus. Okay, then draw the cortex like this. Okay. I'm just drawing very bad diagram, but you have to draw a good diagram. Okay. Now the functions of functions of lens. So we all know that the lens has one main function and only one function, that it focuses light onto the retina. Without lens, can you focus your light onto the retina? No, it is not possible. So a lens is needed. A lens is a must to focus your light to see the objects clearly and to focus it on the retina. Okay. Now, what is after cataract or posterior capsular opacity? In short, it is known as PCO or posterior capsular opacity. Now, opacification of the posterior capsule after cataract surgery. Okay, so if you have performed the cataract surgery, after cataract surgery, what you do, you implant a new IOL, that is intraocular lens. And the new lens is very prone to develop after cataract, which is also known as posterior capsular opacity. So the new lens, in the new intraocular lens, there can be posterior capsular opacity. Okay. Now, what are the types of this posterior capsular opacity? Fibrous and pearl-like. Okay. So there can be proliferation of the lens epithelial cells, which is known as fibrous after cataract. And if there is Sommering's ring formation, it is known as pearl-like after cataract. Okay. A pearl-like after cataract and fibrous after cataract. These are the two types of cataract, two types of after cataract which can develop in the new implanted intraocular lens. You can see in the diagram also, this is the intraocular lens and there's posterior capsular opacity over here. Posterior capsular opacity over here. Okay. Now, how do you treat this condition? You give a ND-YAG laser capsulotomy. Okay. What capsule? Posterior capsule. So you are performing a capsulotomy, making an incision in the posterior capsule. Sorry. Making a posterior capsule, creating a clear visual axis. So this is the light that was entering. Okay. Now here is a posterior capsular opacity, and due to this opacity, the light cannot enter to the lens very properly. Okay. And if you made an opening over here, okay, if you made a laser capsulotomy over here, then the edges of this posterior capsule, it will come together in some course of time. After that, the lens will again the light will again penetrate properly into the lens and you will again be able to see the things very clearly. So this is the treatment, okay? That is ND-YAG laser capsulotomy which can create a clear visual access. So this was about the after cataract. Okay, now here comes the end of our discussion. So we have discussed the senile cataract. Okay, senile cataract, childhood cataract, cataract surgeries we have done. We have done after cataract. We have discussed parts of the lens. We have discussed what is hyphema, and we have discussed about the childhood or the developmental cataract. So this was about in total about the lens. Okay, about the lens disorders that we have discussed. And just remember that lens disorders is a very important topic, and a question of cataract is a must for you in your exams. Okay, it will come in one or the other way, so you cannot just skip this part. Okay, the cataract is a very important theoretically and clinically also. Whenever you are going for rotations or postings, you will encounter a case of cataract in your ophthalmology postings, and it is very important to at least recognize what is cataract and what is not. Okay, so cataract is just the opacification of the lens, and it is not very hard to diagnose. Okay, it is very easy to diagnose. So this was all of the today's session, and I hope you learned about everything, and you remember the key points that you have to write in your answers. And we'll meet again in our next class. Thank you so much.